from our institution with an Associate of Science in Nursing. Since graduation, Justin has worked as a medical surgical nurse at Phoebe Putney Memorial Hospital. During his time at Phoebe, Justin has been nominated for multiple Daisy Awards for extraordinary care in nursing, and he has received additional multiple accolades in his short time at Phoebe Putney Memorial Hospital. His short-term nursing goal is to become a certified registered nurse anesthetist within the next 5 years. Ladies and gentlemen, please join me in welcoming our speaker for this occasion, Mr. Justin Hesheiser.
I'm so proud of him.
Well, okay. Well, good afternoon. So, just get it over with now. I'll have to read it because, first time public speaking, so that's okay. But good afternoon, faculty, staff, family, friends, and of course, my fellow Cavaliers, the graduating class of 2016. I would like to begin by saying congratulations to you all. I know it's not been an easy journey because, as you know by now, I've been there. You all have gone through a strenuous academic and professional journey. That journey can only be successfully completed through hard work, diligence, and determination. The Darton State College nursing program has a very intense and elaborate curriculum, yet through all the tests, clinical rotations, and other challenges, you did it anyway. So I say great job and congratulations to all of you. Here we are today at your pinning. Now most of you might not know why you get a pin at all. Hopefully I can enlighten you on the importance of the pinning. The nursing pinning dates as far back as the 12th century. The Knights Hospitaller were honored with a Maltese pin for caring for injured soldiers in battle. Now, if you guys remember your nursing fundamentals class, and I'm sure you all do, we should remember Florence Nightingale. Florence Nightingale was honored with the Red Cross pin for the great nursing work she did in the Crimean War. Now, the nursing pinning ceremony, as we know it, goes back to 1880. A class of nurses at the Bellevue Hospital School of Nursing in New York were the first to be pinned upon graduation. This pinning ceremony is a rite of passage to symbolize what you have done here. It's also a sign of your readiness to care for humanity in a professional manner. When you wear this pin, try to remember the faculty, the staff, and your colleagues of the Darton State Nursing Program that you are part of your journey and your professional life story. The pin will hopefully remind you that you have 3 missions. The first is to care for your patients and their families. The second is to advocate for your patients. The final mission is to lead, not only in a hospital setting, but also in life. In other words, be the best nurse you can be at all times. You have all scaled one big hurdle, and for that you should be very proud. Most of you have one major obstacle left. I can sum it up with just one word: boards. I know. I hope all of you are ready and confident in your ability to pass the NCLEX. I know you all are ready for the exam because you studied and made sure you were ready. If you can pass this program, you can pass the NCLEX. So just take a breather, all right? With that said, my prediction for you are that you will pass your board exams and you will make great strides towards your upcoming careers in nursing. In the meantime, I'd like to share a few thoughts with you as you move on from here. There's no doubt that Darton State College has imparted in you all a broad range of the art and science of nursing through its intense nursing curriculum. With your broad nursing knowledge, proficient caring skills, and professional attitude that you've acquired through your time at Darton State College, your patients and their families are the better for it. Your local community and even the world are better for it as well. So now you should go into nursing as one who truly cares about their patients, not as one who is in it solely for the money, but as those whose sense of caring is saturated with respect, selflessness, and compassion. Now, when you care for your patients, do so with attention, professionalism, and humility. Attend to them with respect and without being judgmental. Listen and remember that many times you will need to listen more than you need to talk. You'll be surprised that you can learn from your patients as much as they from you, but only if you truly listen. Lost my spot, yeah. You'll be surprised that you can learn. Let's see. And what you've learned from them may be the very information you need to provide the best care for them and others in similar situations. Remember, trust, caring, and honesty will strengthen your relationship with your patients. You are entering a profession that is consistently ranked first in honesty and ethics according to many national polls. It is an interesting side note that in the same polls, congressmen, car salesmen, and lobbyists have ranked the lowest. So as you care for your patients, remember that your patients are counting on your trust and your honesty. Being a patient advocate is also one of your newly acquired missions today. You must remember that your duty to your patient is to be an informed and caring advocate. In the patient's eyes, you should be the most trusting person they know when they are under your care. That is why they will sometimes pour their hearts to you and share with you their needs, fears, and even dreams. Thus, your closeness to your patients gives you those privileges. However, in life, privilege comes with an equal amount of responsibility and accountability. Therefore, be ready to use all of the information you gain from the patient responsibly and in a way that benefits the patient the most. You must advocate for the best for your patient at all times. Finally, leadership is the final part of your mission. If you have not thought about yourself as a leader before, you better start right now because that's exactly who you are. Every one of you, once you become a professional nurse, you have become a leader. It doesn't matter in what setting and position you find yourself, even though your mission is to care and to advocate, it is also to lead. You can only be the best care provider and the best advocate if you also see yourself as a leader and strive to demonstrate required leadership qualities anywhere you work. Class of 2016, strive to be not just a leader, try to be a great leader, a transformational leader. Now, I have not forgotten about our new senior nurses either. Your time is coming soon, and we are also very proud of you all. Just keep studying as hard as you can at all times. Learn as much from your clinical rotations as you possibly can. And remember, your instructors are here for you all. I know I wouldn't have made it without their support when I was going through nursing school. To the BSN nurses, I'd like to say congratulations for advancing yourself in your field. Some of you may continue on into your MSN or even your doctorates. Just know that you are the future leaders of our field and that we are all proud of you. I will leave everyone today with a quote from one of my favorite poets. The late Maya Angelou said, "People will forget what you said, they will forget what you did, but they will never forget how you made them feel." Now think about that quote for a second, guys. Like really soak it in. Nursing is as much about feeling as it is about medicine. Nursing is one of the few fields I know of that are both a science and an art. It is great to know how to read a cardiac rhythm strip, but it's also equally as important to know how to hold someone's hand when they need one to hold. I hope that all of you are successful in whatever you decide to do in the great field that you have chosen. I know in my heart that if I fell ill, I'd be privileged to have any one of you take care of me. Thank you all for your time and congratulations.
Woo!